In this video, we're going to talk about 12 strange signs that could mean your liver is not doing well. It's crucial to know these signs because you can stop the liver problem from getting worse. The liver can actually heal itself with a bit of help. Liver disease affects more than 25% of people worldwide, and it's becoming more common. Many people think liver damage only happens if you drink too much alcohol. But it can also come from eating too many sugary or processed foods, using certain painkillers a lot, getting viruses like hepatitis, having too much iron in your body, and being exposed to harmful stuff in the environment, like pesticides and plastics. So if you want to check if your liver might be in trouble, watch the whole video. We'll also share some natural ways to take care of your liver at home and prevent more damage. Remember, this video is just for learning, so talk to your doctor if you have any health concerns. The first symptom of liver problems is having pale stools. When you use the bathroom, your liver releases bile acids to help digest the fats in your food, giving your poop its usual brown color. But if you have fatty liver disease or liver damage, this bile flow can get messed up, and your poop might turn lighter or clay-colored. Sometimes the poop can even float in the toilet because there's undigested fat, making it floaty. The second symptom is a swollen right foot. When your liver's blood flow isn't normal, it can make your liver swell and press on the portal vein. This pressure can cause fluid or water to build up in your legs or feet. If you notice that your right foot or ankle is more swollen than the left one, it's a common sign that your liver might be damaged. We'll talk more about natural ways to help your liver work better later in the video. Symptom number 3 is having trouble seeing well at night. If you find it hard to focus or see in low light, it could be because you're lacking in retinol or vitamin A. Your liver's bile helps you absorb vitamin A, which is crucial for your eyes to adjust to different light levels. But if you have liver disease, the reduced bile means you're not getting enough vitamin A, leading to what we call night blindness. This might also suggest a congested gallbladder, especially if your eyes feel dry, sore, irritated, and gritty. Sign number 4 is feeling pressure on the right side. Another possible sign of liver disease is feeling pressure or discomfort on the right side of your rib cage, especially after eating. Liver damage can make the bile thick and sludgy, which can block the small tubes connecting to your gallbladder. This blockage can cause a sense of pressure and discomfort around the ribs. The pressure may also affect the phrenic nerve, leading to muscle tension and pain in the area around your right shoulder. Sign number 5 is having white growths on your eyelids. Another strange sign of liver damage is seeing white or yellowish growths around your eyelids. These are little pockets of cholesterol deposits that collect under your skin because your liver isn't breaking down cholesterol like it should. This causes cholesterol to build up in various parts of the body. Next, let's talk about sign number 6, which is having cracked heels. Your skin needs vitamin B3, also known as niacin, to stay strong, smooth, and moisturized. However, if you have liver disease, your body uses up its niacin reserves to fix the liver damage, leaving less of this important nutrient for other purposes. This can result in dry and cracked skin on the soles of your feet and heels. You can improve this by getting more vitamin B3 and dealing with the main issue, which is often fatty liver disease. Moving on to sign number 7, we're talking about purple and red spots. When your liver is congested, inflamed, or damaged, it makes fewer proteins necessary for regular blood clotting. This makes you more prone to bruising. And sometimes you might notice unusual purple or red bumps resembling a rash on your skin, along with small red patches. This often occurs around the lower legs or arms due to poor blood circulation, which can be a result of liver disease or possibly diabetes. Number 8 is having all white or clubbed nails. If your fingernails start turning completely white and lose their pinkish color, or they become rounded, clubbed, or bulbous in shape, it could signal significant liver damage or another underlying health issue. This condition may be hindering oxygen from reaching the nail matrix. In the 1950s, researchers found that 8 out of 10 people with severe liver scarring had nails that turned all white. Number 8 is having all white or clubbed nails. If your fingernails start turning completely white and lose their pinkish color, or they become rounded, clubbed, or bulbous in shape, it could signal significant liver damage or another underlying health issue. This condition may be hindering oxygen from reaching the nail matrix. In the 1950s, researchers found that 8 out of 10 people with severe liver scarring had nails that turned all white. Another sign of liver disease is feeling a constant need to scratch the palms of your hands or the soles of your feet. This happens because there's a buildup of bile acids under the skin, caused by the liver not properly filtering these acids. This buildup results in an increase of histamines in the bloodstream, causing the sensation of itching. Sign number 10 is having yellowed skin. When your liver isn't working properly and can't filter bilirubin effectively from your blood, it can cause a change in your skin color. This leads to a yellowish tint on the skin, a condition called jaundice. Jaundice is a clear sign of serious liver damage, possibly due to conditions like hepatitis, cirrhosis, or drug poisoning. If your skin turns yellow, it's important to get medical help and talk to your doctor. Sign number 11 is having dark urine. Your liver is responsible for breaking down old red blood cells, which contain a yellowish pigment called bilirubin. If your liver or gallbladder gets damaged, this pigment can accumulate in the body and get flushed out through urine. As a result, your pee may have a very dark orange, amber, brown, or cola color, because your liver isn't breaking down the pigment as it should. Certain medications, like antibiotics, sleeping pills, or birth control pills, can also contribute to this issue by weakening the liver. Finally, sign number 12 is spider veins. Spider veins look like small red dots, with spider-like extensions of blood vessels that show up on the skin. These blood vessels get damaged because your liver isn't effectively filtering out excess estrogen. High estrogen weakens the blood vessels in the veins, causing them to dilate and become visible on the skin. If you have one or more of these symptoms we've discussed, it's highly recommended to see your doctor and request an ultrasound test. This test is simple and non-invasive, using sound waves to create an image of your liver and its network of blood vessels. It helps determine if there are any fatty deposits building up inside. The good news is that the liver is one of the few organs in the body that can completely heal and regenerate. How to reverse liver disease. As I mentioned earlier, the liver goes through 4 specific stages of damage. First, it collects fat, then experiences inflammation, leading to the development of scar tissue called fibrosis. In the most advanced and potentially life-threatening stage, it advances to cirrhosis. The good news is there is hope, because the liver has an incredible ability to completely regenerate and recover when you make dietary improvements and use the right remedies. So, let's walk through the most crucial steps to reverse liver damage. Improve your diet. Cut back on sugary, starchy, and flour-based foods like bread, biscuits, sweets, ketchup, pancakes, pasta, soda drinks, etc. A fatty or damaged liver is sensitive to fructose, which is fruit sugar, much like it is to alcohol. So it's crucial to completely avoid drinking fruit juices and alcohol. Include plenty of bitter sulfur-rich foods in your meals, such as leafy greens, arugula, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, wild salmon, oily fish, walnuts, onions, scallions, and broccoli sprouts. Foods high in sulfur help remove fat from your liver by increasing glutathione levels and aiding in detoxifying harmful substances. Drink 1 cup of homemade organic coffee each morning. Brew 1 cup and add a teaspoon of turmeric. The polyphenols in coffee and the phytonutrients in turmeric are effective at minimizing the formation of scar tissue in the liver and aiding in its recovery from damage caused by alcohol, drugs, or fructose. Also, try to drink at least 1 liter of high-quality mineral water throughout the day to help thin your blood and assist the liver in producing bile to break down fatty deposits. For improved toxin filtration in your liver, think about including freshly squeezed lemon or lime juice. Avoid consuming inflammatory seed oils, like corn, cottonseed, canola, rapeseed, soy oil, cheaper processed olive oil, margarine, etc. Instead, opt for anti-inflammatory fats such as extra virgin olive oil and virgin coconut oil in your homemade recipes. These fats have been shown to possess liver protective properties. Follow the 18-6 fasting rule. This means fasting for 18 hours and eating within the 6-hour period. I recommend eating between 12 p.m. to 6 p.m., but you can adjust this window to fit your schedule. This approach, known as intermittent fasting or timed eating, significantly enhances liver health by reducing inflammation and boosting insulin-like growth factor, a hormone that prevents fat buildup in the liver. Fasting also triggers autophagy, where your liver recycles old, damaged cells and proteins to generate new, healthy liver cells. Remove fatty deposits and reduce inflammation. In the liver. Take purified bile supplement in the morning on an empty stomach. You can use purified bile salts or a digestive enzyme blend containing oxbile in the ingredients. These supplements not only assist in eliminating fat from your liver, but also help prevent the formation of gallbladder stones.